So we'll start with abduction of the shoulder. So if you put your arms up like that, this movement is controlled by the C5 segment of the spinal cord. When Tom adducts at the shoulder, so bring your arm back in towards you, back in towards the body, that's controlled by the 6, 7 and 8 myotomes. Thank you. Relax, Tom. What I want you to do now is bend your elbow upwards, so bend up towards you. I'm testing his strength there, and that is the cervical 5 and 6 segments controlling that. He's now going to push his arm away, extension using triceps, and that's the C7 and 8 segments. Okay, could you make a fist for me? So if you cock your fist up, bend it up towards you, this movement is controlled by C6 and C7, and extends, and again C6 and C7. Put your fingers out straight for me, Tom. And now if you grip my finger tightly, try and hurt me. So these are the long flexors of the fingers, and that's the C7 and 8 segments. And if you spread your fingers and keep them straight, stop me bending them, and again, that's C7 and 8. And I'm sure you'll all remember that the intrinsic muscles of the hands, if you spread your fingers apart and pop your thumb up towards the ceiling, these intrinsic muscles are all controlled by the T1 segment of the spinal cord. Good. We'll now have a look at the dermatomes. So can I just put you into what we call the anatomical position? And if you just turn to the back. So C1 doesn't have any dermatomal representation, but coming up over the back of the head and behind the ear is the cervical 2, the second cervical segment. C3 forms a ring a bit like a choker around the neck, and then C4 coming down as a cloak onto the shoulders. Tom, if you could face the camera now for me and put your hand into this sort of position. The C5 dermatome comes down the outside of the arm, just beyond the elbow, into the top of the forearm. The C6 dermatome runs down the outside of the forearm to the thumb and involves the first finger as well. The C7 dermatome runs down the front of the forearm, and if you can remember that it's the middle finger, is always supplied by the C7 dermatome. The C8 dermatome runs on the inner or medial aspect of the forearm down to the little finger and running up onto the medial aspect of the arm, and then the axilla is T1. So remember that discrepancy between this sensory representation of T1 being in the axilla and the motor being in the intrinsic muscles of the hand. We might as well just work our way down the dermatomes. So thoracic 4 comes at the nipple line, thoracic 10 at the umbilicus, and lumbar 1 in the groin. We can now look at the myotomes controlling the leg movements. So Tom, if you could just lift your knee up for me, just one of them, that's fine. If you lift them both up, you'll fall over. And these are the L2 and 3 segments of the spinal cord, controlling obviously the L2 and 3 myotomes. Now, just put your leg down, turn around slightly, and then when you bring your leg backwards, so just bring your leg backwards, that's extension of the hip, and that's controlled by the L4 and L5 myotomes. Okay, if you can face the camera again, just want you to lift your knee up like that for me. Good. And now I want you to kick the lower part of the leg forward. So that's extension of the knee, and that's controlled by the L3 and 4 myotomes. And then we'll do flexion at the knee, bring it back, and that's controlled by the L5 and S1 myotomes. Down to the foot now. Dorsiflexion of the ankle, so just lift your foot up like that, is L4 and L5, and then plantar flexion is S1 and S2. We'll now have a look at the dermatomes. We've already mentioned that the L1 dermatome covers the groin. The front of the thigh is L2. The front of the knee is L3. The inside of the calf is L4. The outside of the calf, running down onto the dorsum of the foot towards the big toe, is L5. Turn around slightly for me, Tom. The S1 dermatome covers the little toe, the outside of the foot, turn around a bit further, and comes up over the back of the heel up to midway up the calf. The S2 dermatome then runs up the back of the calf and back of the thigh, and then you'll remember that the perianal region area is covered by the S2, 3 and 4 dermatomes.